thank you everyone for joining us. So in case you didn't know where you are at the One You East Sussex webinar on making every contact count today. So my name's Lisa, I'm the engagement lead at One You, and I'm here with Charlotte, who's our training lead. And yeah, the idea of today is to give you a bit more information about what making every contact count is, and about the free training that we offer at One You for our partners. So would you go on to the next slide, please, Charlotte? Thank you. So the running order for today, I'll take you through a very brief look at what it is that we do at One You East Sussex and how to refer into the service. And then I'll pass you over to Charlotte for the main event, and Charlotte will let you know what training it is that we offer, a bit more about what MEC is, what the course covers, and how to book onto a session. So please do feel free to type into the chat box any questions that occur to you as we're going through the presentation. And then there is the opportunity at the end for a question and answer. So we'll revisit anything you pop into the chat box then, and you're also very welcome to unmute at that point and ask any questions in person. So next slide, please, Charlotte. So what is it that we do at One You East Sussex? Have people heard of us before? Are most people attending today? Maybe you could do a little show of hands or do a reaction or something.
Quite a few thumbs up there.
Yeah, well, that's good. Yeah, so a couple of people have heard of us before. That's good news. So hopefully I won't be taking you through too much of what you already know, but we thought it might be a useful recap for people, or a useful bit of information to know what it is that we're all about. So putting it simply, we are the county's free healthy lifestyle service, and we help people to make small changes that can lead to big impacts in their health and well-being. You can hopefully see that the menu of support on the right hand side there that we can offer. So people who are looking to give up smoking or eat well, move more, drink less or lose weight, we can help with all of those things. So we offer a sort of free healthy lifestyle service to everybody living in East Sussex, apart from Brighton and Hove, who have got their own service. And really the aim of our service is to reduce the prevalence of lifestyle risk factors in the county, risk factors that can lead to morbidity and mortality associated with this healthy lifestyle, poor health risk factors. The ultimate aim really is to reduce the demand on health and social care services. We are commissioned by East Sussex County Council, funded by Public Health England funding. So we are completely free. We're not means tested. We have over 70 clinics across our area of service in East Sussex. We also have a mobile clinic camper van called Colin, who helps us get out and about into the more rural and high need areas of the county as well. Next slide, please, Charlotte. So when we receive a referral, the first thing that we offer people is a health assessment. And this is just so we know what it is that they're struggling with, what they'd like support with, what their goals are. And this enables us to triage them into the most appropriate pathway. So our healthy lifestyle coaching services is one of the main provisions of support that we offer. And for that, we provide 12 weeks of one-to-one support to help people achieve their goals. And this is mainly for the move more, eat well and drink less pathways. People looking for one-to-one support with their weight management can have this in this setting, in the healthy lifestyle coaching. So for adult weight management, we also have an arm of our service specifically aimed at that, and that is also in small group settings. And so we offer 12 weeks support in these small groups, and it It covers, so it's a little bit like Slimming World or Weight Watchers, except for it's not sort of focused on a diet as such. It's more about sustainable, healthy lifestyle moving forwards. And that's really quite successful. It's quite often held in community settings like gyms and leisure centres. And where we're in those settings, we've been able to work with our partners there to also offer free gym and swim passes in some of those locations. So it's not across the board, but it's in quite a few of them. And for people who prefer to be a bit more self-led and maybe access services at different times, we've also got an online offer called GlowG. And people can have a weekly call with a health coach still, but they can sort of work through a program at their own pace online. And we also have an arm of our adult weight management aimed specifically at men called Man v Fat. And this is six-a-side football, essentially, but the matches are decided on weight loss as well as goals scored. And that's very successful and seems to tap into that competitive nature that some men have. So it's very good at helping men reach their weight goals. Another key service we offer is NHS health checks. So this is the only one where we don't do an initial health assessment because the service itself is a more comprehensive health assessment. It is in essence an MOT for your heart. So they take your blood pressure, your height, your weight, your heart rate, do a little pinprick test and test your blood for your cholesterol levels, ask you lots of lifestyle related questions. If risk factors are coming up high for potential diabetes, they can also test your blood for that as well. And it takes about 30 minutes. And at the end of that, you get told what your heart age is, your likely risk of a cardiovascular event in the next 5 to 10 years. And also you get given personalised healthy lifestyle advice. And this information is shared with your GP. So that's our NHS health check service. Quite often they are held in community settings. Some people can't get to or don't like going to the doctors. So we also try and get out and about on Colin, the camper van, to deliver those as well. Next slide, please, Charlotte. One of our absolute key services that we offer is stop smoking support as well. So again, it's that magic 12 weeks that we offer, which is the thinking on what it takes to change habits. And the offer involves 6 weekly meetings followed by a further 3 fortnightly meetings. And we take a two-pronged approach to supporting people with giving up smoking. So we've got the behaviour change support, but we also offer people nicotine replacement therapy. So that could be in the form of gum, patches, e-cigarettes, and it tends to be on a reducing dose over the 12 weeks. So by the end of the 12 weeks, you're nicotine free. And along the way, people have their CO2 readings taken to validate the results, check they're not having the odd crafty cigarette. But again, it's very successful. We've helped loads of people give up smoking, thousands of people, and we have got Stoptober coming up next month as well. So we'll be doing a big push on helping a lot more people. Finally, the other thing that we run at One You East Sussex is the Active Eastbourne and Lewes partnership. This was newly established this year, and the idea is that it brings together individuals, communities and organisations to make sport and physical activity more accessible and leads to improvements in people's health and well-being. So those are the main services that we offer. Next slide, please, Charlotte. So yeah, it's really easy to refer into the services. Professionals and individuals can refer you by going onto our website and using the Get Started button. You can see in the top right-hand corner there. It's just a simple form, takes about 5 minutes to fill out, and then our support team will get back to you within 5 to 10 working days. Or you can phone us, and the number's there on the screen, or you can email us at hello@ And again, that address is there on the screen. And I will share these slides, by the way, after the session today with you. So that's a whistle-stop tour of what we do at One You East Sussex. And I'm now going to pass you over to Charlotte, because the other main thing that we do is offer training to our community and voluntary sector partners. And Charlotte's going to tell you all about that now. Thank you, Charlotte.
Thank you. Thanks, Lisa. So yeah, as well as all those wonderful things that we offer here at One You East Sussex, we have our kind of package of training that we provide. So first thing there on the slide is making every contact count. We call that MEC. So as I go through this, the slides, I might refer to it as MEC for short, and it's what I'm referring to is making every contact count. And we offer 2 levels of that, and I'll be talking in a lot more detail later on about what that means, because that's obviously what you're here to learn about. Some people aren't aware that we do also offer NHS health check training. So Lisa talked just now about us providing the NHS health check service within the community. But part of our training package is that we actually work with local primary care. So that would be GP practices to train up perhaps their healthcare assistants, their practice nurses, to deliver the NHS health checks within their surgeries. That might be a full sort of half-day training where someone has never done a health check before, or perhaps they haven't done it for quite a few years and just need a bit of an update on it as well. We also, in addition to that sort of full half-day face-to-face training, provide refresher training. So for someone that just wants a bit of a refresher on how to do the health checks, we provide that online as well. And we provide 3 sessions of health check training per year, face-to-face, and 2 refresher trainings online. And they're always listed on our website and on our Eventbrite pages. We also provide stop smoking advisor training, but only on request. So as well as providing stop smoking support as part of our service, we also provide training mainly for healthcare professionals that perhaps are based in hospital settings or in pharmacies or in GP surgeries. We say on request because it's not something that's asked for a lot. So for those of you, I know there's a few people here today that are from GP practices. If that's something you're interested in, then that's something we can discuss with you at some point. And again, this is probably more applicable to those in primary care. We also provide, provide the COBAS training, which is the machine that does the health checks, the blood tests. Roche actually provide that training, but we facilitate that for them. So there's a wealth of training available to people, particularly those of you that are working in primary care and GP surgeries. So going into more detail around what actually is MEC, so making every contact count. It's actually a national training programme. So it's developed by Public Health England. We deliver it for free, and I always emphasize that it's free because sometimes I know that people want training and it can come at a cost, but it's absolutely for free. It's part of our commission service, and it's a behaviour change approach to training that really helps give people those tools and those skills to improve those conversations that you might be having with people around their health and well-being. So it's recognizing those opportunities where those conversations might happen, and then supporting that person and encouraging them to maybe go on a journey of behavior change around their lifestyle, around their physical health, their mental health, by having that kind of skillful conversation, but also knowing about signposting, because we always say with MEC, it's not about becoming an expert yourself in health and well-being and in lifestyle interventions. There's a wealth of organisations like ourselves here at One You East Sussex, but also elsewhere across the county that you can effectively signpost people into for further support. There is a Public Health England definition for MEC, so I'm going to read it out because it's quite interesting. So making every contact count is an approach to behaviour change that uses the millions of day-to-day interactions that organisations and people have with other people to support them in making positive changes to their physical and mental health and well-being. And I like to also think about it as life skills. You know, it's day-to-day conversations that you might have, not just only in your workplace, but in your communities, while you're standing in the queue in Asda or at the pharmacy, but also with your friends, with your family. It's really transferable skills, um, where we want to effectively support people to make positive change. So I've got a slide next on what making every contact count actually is. And this is a bit of an excerpt from our training. So we want it to be opportunistic. So what we don't want people to do is think, oh gosh, I've got to go and mech everybody that I next speak to. It needs to be something that happens quite organically, quite naturally, and that comes with practice. It's always about signposting. So as I said earlier, it's about being aware of appropriate places that you can signpost people to, both locally but also nationally. We want it to be quick. We've got on there a maximum of 3 minutes. We're certainly not going to start timing people as to whether your conversations are 3 minutes or longer. We're not going to start timing that. But what we're basically saying is we don't want it to create more work for people. It should be about making those conversations that you're having more effective in a shorter space of time. It's very much about prevention. So as Lisa mentioned at the beginning around our lifestyle services, it is about prevention, the preventing people from becoming unwell, and improving quality of life. So that's why we have lifestyle improvement on there as well. So we want people to live longer, happier, healthier lives, and it should be really supportive. So I'm sure a lot of you are already recognizing maybe the types of people you have conversations with and support people. So MEC is very much about encouraging that supportive nature as well, and it's very much about health promotion. So promoting the often those sort of health behaviours that we are all aware of, like eating healthily, making sure you have your 5 a day, movement. We don't like to use the word exercise. It does bring up lots of negative connotations, but moving better and moving more, drinking lots of water and maintaining good health and mental health and well-being as well. I think what's really important though is also to think about what MEC actually isn't, which is what's here in the black text. So certainly not about what to do. I know myself, if I get told what to do, I'm certainly going to do it. And MEC is very much about empowerment. So having that mutual respect and empowering people to make those decisions, and make those behaviour change choices themselves. It's not necessarily about providing ongoing support. Some of you in your roles might be supporting people, or you might have staff that support people on an ongoing basis. It's that fine line around boundaries and not sort of becoming a crutch for people. I've just noticed someone said that my connection went, so apologies for that if anyone's struggling to hear me. It's not about making more work for people. So we know that we're all really busy, aren't we? We've got huge amounts to get through in our day-to-day work life, but also in our home lives. So again, this is about making it more effective. And it's not about becoming counsellors either. So again, it goes back to that boundary setting. It's so easy to become a counsellor to somebody. And MEC, again, is about empowerment, about encouraging that person to make those changes themselves and supporting them to do so. There are other services that might be able to support them better in terms of counselling and mental health and well-being. So I want to cover just some of the core skills that we look at in MEC, because when we provide our sessions, there's lots of discussion, and people come with such a wealth of experience, but we really like to send people away with some core skills. So we look at something that's called the COMBI model of change. So it's about understanding what elements, what factors people need to enable that behaviour change to happen. And that would be about being capable, having the opportunity, but also being motivated. So COM actually stands for capability, opportunity, and motivation. And we look at that in quite a lot of depth in the training. We also look at motivation. So how are people motivated? Because motivation, when people are wanting to make changes or changes in their lifestyle, that's a really big factor. So we look at what's something called intrinsic and extrinsic motivation, and how to draw that out of people through having MEC conversations. We also look at people's self-efficacy and self-confidence. We know that if people lack confidence in their own ability, And making changes to their lifestyle can seem like a huge task. So we look at what builds self-confidence and what builds on that self-efficacy, and how to, again, support somebody to build on that as well, to enable them to make changes. And we also look at the three zones of your brain. So most people are aware of kind of fight or flight. So that would be that threat zone. We look at the contentment zone and the drive zone, and the roles that all of those play when we're having conversations around behaviour change. And it's really useful to understand where people's, what zone their brain might be in when we're having conversations with someone about making changes. We also look at identifying change talk. I like to call it those little golden nuggets where someone is perhaps demonstrating or giving a little hint that they might be ready to make some changes, but it's actually around a lot of kind of negative talk as well. Things like, I haven't got time to exercise, I haven't it's really tricky for me to make a healthy meal. But spotting the moments when they say, but actually I used to really enjoy going for a walk every day, and spotting those little nuggets and drawing that out of that individual. Things around evocative questions. So some of you might know that around open questions, a little bit around motivational interviewing. So we cover that during the session as well. And we know that when we're working with people one-to-one around supporting them to make lifestyle changes, listening is a really, really big part of that on our side. So active listening, we cover that, and we do a really interesting activity on active listening, which is quite good fun. And signposting. So we just have a sort of short part of the training is exploring the local and national organisations that you can signpost into, and a discussion around what supports people that they already know about in terms of signposting. So lots to take away, and lots of core skills that people are going to go away with after a session of MEC. And as I said at the beginning, we offer two options. So we have our level 1, which is 1 hour, and I always think of this as a bit of a kind of introduction to MEC. Can be delivered face to face or online, a bit like this. So it's really, really good for those that perhaps want it as part of a meeting, a team building day. We've delivered it as a breakout session during kind of big, large scale events where there's lots of breakout rooms or a workshop. That works really, really well. And it's a bit of an introduction to MEC. And a great sorry, I just jumped then because my doorbell rang. Apologies for that. A great option for those looking for the introduction or as a refresher to MEC as well. And for some people, they'll do the level 1, and then maybe a few months down the line, they'll actually choose to do level 2, the full version as well. So it's a bit more of a summary of the content and the concepts of MEC. With level 2, that's our 3-hour session, and that works best as a face-to-face session. Because there's lots of opportunity for discussion and for practice. It doesn't really work online quite as well. It goes into a lot more detail. So those core skills that I was just talking about, there's opportunity to practice those, get into groups, get into pairs, and explore those in a lot more detail. And it's often our level 2, our 3-hour session is often better for those that are in a role that may use MEC on a more regular basis. So that might be if you're working in the community one-to-one with people, might be if you're based in a GP practice and you're working with patients one-to-one and having lots of conversations around their health and well-being. This is applicable though in all settings. It could be in businesses, it could be in charities and voluntary sector organisations as well. But the nice thing is there's the two options there to choose from, and it's very much about sometimes having a conversation with myself or even Lisa, and I have a colleague, Sam, who's fantastic about just kind of meeting with you to decide what you think might be the best option for you. So a little bit about what we've done so far this year. So far since April the 1st, we have delivered 19 sessions of MEC in all sorts of different settings. We've done it for GP practices where they've had their protected learning time. For example, this week I was with the Macmillan Volunteer Cancer Champions in Hastings, and some wider community and voluntary sector organisations delivering MEC for them. We've worked with schools, with the universities, with the colleges. So it works really well across the board. So we've done 19 sessions so far, and 255 learners. So it's been a fantastic year for us so far. We do online feedback, so we capture all the data online for people. So 100% of people are enjoying the session, which is always really, really reassuring to see, and testament to our team of facilitators. And 96% of people said they gained new skills and confidence. And 100% of people are aware now where to refer into for further support. So really positive outcomes for us, and hopefully this is something you can see for yourselves if you were to book a session. Which leads me on nicely around how you book a session. So as I said a lot of times today, it is open to everyone. So that does include healthcare professionals, charities, community and voluntary sector organisations, as well as kind of the education settings like schools, colleges, but also businesses and private businesses. It's anywhere that you're going to be having conversations with people around their health and well-being. And as I said, we can offer bespoke sessions. We come to your workplace if you have a space for training, and we can come along and deliver that session, or we can host the session online if it's the 1 hour level 1 session. It's very much on an agreed basis. So, we work on dates as a partnership really, and discuss what suits the timings that might suit your staff or your colleagues. So it's very much a joint venture between ourselves and yourself when we're booking in. What we've also found has worked really well in the last kind of 12 months is we also lay on some what we call open MEC sessions. So we know that there are some smaller organisations and businesses where they might not have a huge amount of people to put on an entire training session themselves, and there might be just 1 or 2 people that would like to attend a MEC session. So we have that option at our offices in Eastbourne. We have a fantastic conference room there. So we lay these on twice a year for people to just book on as an individual. And what's been fantastic with those sessions is because it's such a broad spectrum of people in that room, the learning from that, there's often a little bit of kind of networking that goes on. It's really, really interesting to see people from all sorts of different backgrounds coming together, and not just learning the MET concepts, but also networking and meeting new people. We do have minimum numbers for our training. So online, ideally for a level 1 1 hour session, we'd like a minimum of kind of 7 to 8 people. And the same really for our level 2 session. Ideally, sort of 10 plus is fantastic. Between 10 and 16 people is a really good number of people to come and do training for. We do go bigger, and that works quite well, but you can imagine as a trainer, if you've got kind of 50 people in a room, it's a lot harder to do some of the kind of discussions and pair work, because you can't get round everybody. But to make it effective for everybody, we want a really good number though. So I would much rather have a few too many people than only have 1 or 2 people in the room. So that's something we can discuss when we're talking about putting on a session. On that slide there, we've got the information on how to get in touch. So you could just send me an email, or our marketing email as well is monitored by a whole team of people. So if you can't get hold of me, and I do work part-time, you can email that marketing at One You East Sussex email. And as I said at the beginning, we do update all our training opportunities onto the training tab of our website, which there's a little screenshot of it there. And we use Eventbrite. So for things like our NHS Health Check training, for our open MEC sessions, there will be a link on there where you can actually book a place, a bit like you did for this session today. It seems to work quite well. It enables us to monitor the numbers, and send you emails and update you on how to join a session, and if it's face-to-face, things like parking information, where the session might be taking place. So Eventbrite works really effectively for us, but everything's always updated on that training tab of the website. Here's the kind of key contacts. So I'm, as Lisa said at the beginning, I oversee the training here at One You East Sussex. So those are my contact details there. Lisa and I work really well together, really closely. So Lisa, as our engagement lead, is the one-stop shop to go to for things like if you want a service overview, so some information about One You East Sussex as a whole service, a bit like what she went through at the beginning, but can also facilitate any training inquiries as well. So that's pretty much it around our training offer and making every contact count. Lisa, is there anything that I missed that you'd like to add at all?
I don't think so, Charlotte. I think you covered it all very well and it was very interesting from my point of view as well. I hope everyone else found it interesting too. I can't see any questions in the chat, but if anybody does have a question, please do feel free to unmute and ask
I'm going to
away.
stop. I'm going to stop sharing so we can see each other, and then that might be easier to see if anyone's got any questions.
Yeah.
Oh,
Councillor
some
Vicky Cook.
Vicky.
Thank you. Yes, I just wondered, is there a minimum age that we could signpost people towards you? I work very closely with a lot of sort of young teens through Girl Guiding and through my church youth work, and sometimes you just get this feeling that something's not quite right with somebody, and perhaps if they came along and talked to you, I just wondered if there was an age limit.
Shall I answer that, Charlotte?
Yeah, yeah.
Yeah. So most of our services are aimed at adults,
Okay.
although our smoking cessation service, actually, we can help people aged 12 and over.
Good gracious.
Yes, obviously we don't issue them with the nicotine replacement therapy, but with parental permission, we can help with the behaviour change. Although honestly, we're finding more inquiries about vaping than smoking with that age group, truthfully. But all of our other services are open to everybody. There's some eligibility criteria around the health checks. So you have to be aged between 40 and 74 for the health checks. And there's a few other eligibility criteria as well around certain health conditions that mean you can't have a health check because hopefully you've already been looked after.
Yes.
But on the whole, we're happy to speak to everyone. I mean, we're not a specialist mental health service. So if you were concerned about somebody's mental well-being, you might be better off signposting them to Mind or Change, Live, Grow, or one of the other local services with regards to mental health services. But we can always do an initial health assessment and then signpost people on as appropriate as well.
So if I were to have a group of young people aged 15 plus, would it be appropriate for you to come and just generally have a chat with them for about 30 minutes in one of their sessions about this whole thing about a healthy lifestyle in preparation for them going off to university or anything like that?
We have done sessions at colleges, so it tends to be 16 plus where we've done that. And indeed, we've delivered MEC sessions, haven't we, Charlotte, to college students on appropriate sort of customer-facing courses, things like sports and sports management and things like that. Yeah. So we can do that. We tend to do that with colleges rather than schools. But we'd certainly be happy to go into youth clubs and youth sessions and that if there was interest, then yes.
Oh, that's really helpful. Thank you very much indeed. I'm also on the board of the I'm in Battle and our Claverham Community College Sports Centre. The chappie there, whose name's completely gone out of my head. Do you do anything for people with dementia? He would love to put on this kind of a session. I know, not just for young people, but as a general, he's very concerned about, sort of mental health and people being distanced and not accessing easily, health and looking after themselves rather than relying on somebody else to do it. So I might, well, if I may, please keep your details and pass them on to him. Lovely. Thank
Yeah,
you very
please
much
do.
indeed.
Please do. Thank
That's
you.
great.
And we will share the slides from today with all the contact details on. And we will also ask you to complete a very short feedback form as well, please, if you could. That would be very helpful. And then we can keep
Yeah.
improving these sessions from the feedback you give us.
Definitely.
Yeah.
There is a question from Maria, the team there. Maria, I'm going to call it Maria's team. When you say adult, does that mean 16 as per some NHS systems, or 18? So, Lisa, you're probably best placed to answer that again.
I believe it's 18. Apart from our smoking service, we can help people from 12, and with our training as well, we have a bit more leeway. We can deliver training to people over 16, like I say, to college students.
Yeah. Any other questions or comments? Anything wasn't clear at all from today's session?
Sorry, say that again, Charlotte. You broke.
Oh, sorry. I'm going to check my internet. It must be my end. I was going to say, any other questions, comments, or anything that needs clarity from today's session? Anyone need any clarity from anything we've covered? Can see some typing. All good here.
Brilliant, lovely. Oh, thank you all very much for joining us, and we hope you found it useful. And yeah, please do get in touch with any other questions